Good morning, everybody. Welcome to Facial Plastics Friday. It's Dr. Brace here, and today we're continuing our rhinoplasty talk, focusing on the nasal tip. And so one of the common questions in a rhinoplasty consult is, can you make my tip smaller? Can you make it less bulbous, less boxy, more of a triangular shape? And the answer is yes, we can. And the way we do this is different for each patient. And so we're going to review that today. So if you remember from last week's video, the nasal anatomy, we have the lower lateral cartilages, and this part of the cartilage is called the lateral crura, the lateral legs. It's the part that makes the dome in the tip of your nose right here. We have the upper lateral cartilages above it, and then the nasal bones. And so the tip is really formed primarily out of these cartilages here. And so there are different techniques to refine the cartilage in the tip to give the nose more of a refined look. This is different depending on your skin type. So the thicker your skin, the less reduction of the cartilage you can do, and you actually have to build up the cartilage to make a refinement because you have to stretch the skin. If you have thinner skin, then you can actually just make the cartilages smaller, and that will show through the skin as a smaller looking nose. And so the first technique is called a cephalic trim. And a cephalic trim is where we excise cartilage from the upper portion here to make these portions of cartilage smaller. Cephalic in medicine just means the upper part, the part towards the head, cephalad. And so we trim this cartilage off so that it takes up less room, it's less bulky, and that can give you a smaller, more defined tip, less fullness right in there. You have to be careful doing that though. A lot of techniques in past decades would remove too much cartilage and would cause nasal valve collapse and nasal pinching because there's not enough cartilage here to support the nasal valve, to support breathing and scar tissue contraction after surgery. And so a general rule that we follow in rhinoplasty is that you have to maintain about 8 millimeters of width in the lateral crura to prevent that complication. If you go smaller than that, you have to take a lot of precautionary steps with other grafts to prevent the nose from collapsing on itself. And so cephalic trim is one way to do it. Another way you can refine someone's tip, if their cartilage is already small and you don't need to take any cartilage away, you can use suture techniques. And so sutures that cause the cartilages to bend more acutely to make this angle in here sharper are called intradomal sutures, and we can use sutures to bend that cartilage tight so that I'll show with my hand here. If the cartilage is bent like this and we bend it tighter, it will make this look smaller. So intradomal sutures, and then interdomal sutures are tip binding sutures. You can bring these two cartilages together if they're too far spread apart and narrow the tip that way. And so those are the common techniques used in somebody with medium to thin skin thickness. When your skin is thicker, if you're talking about an Asian nose or an African nose or a Persian nose, when the skin is thicker, you often have to make the nose bigger. And so it's almost impossible to make the nose physically smaller and more defined in the tip. You actually have to stretch the skin. And so that involves using different grafts on top of these cartilages to build this area up into a smaller point so that when the thicker skin is stretched over it, you'll get a more refined tip. So that's nasal tip anatomy. I wanted to add one little pearl, one little video here. I saw a patient this week who was having a lot of trouble breathing and wanted some cosmetic changes to her nose. And we had talked about nasal valve collapse in the past. Her nostrils, her lateral nostrils collapse, and you can see it on the video I'm going to show right here because these cartilages have a paradoxical recurvature. Instead of coming out, they actually dip down and in and create big dents. So she's had 2 surgeries on her nose to address her septum to try to make her breathe better, and they haven't worked. And there's no surprise because she has a paradoxical recurvature of her lateral crura, and this is pinching inside her nose, causing a nasal valve collapse. And so this needs strut grafts or grafts to actually straighten this cartilage so it supports the nose and gets it out of her nasal airway. So send us your questions on rhinoplasty, on tip refinement, and everybody have a great weekend. Happy Facial Plastics Friday.